for us today, we have the sphenoid bone, which is another bone of the skull or the cranium. And we are told that the sphenoid is the most complex bone of the cranium, and it's located between the bones of the cranium vault and those of the face. It articulates with all other cranial bones, holding them together. When cranium floor is viewed from superior, the sphenoid articulates anteriorly with frontal and ethmoid bones, laterally with the temporal and parietal bones, anterolaterally with the parietal bones, and posteriorly with the occipital bone. A sphenoid is simplified by dealing with four basic parts of the bone, which is the body, the greater and lesser wings, and the pterygoid plate. So let's get to the skeleton of the skull so that we can be able to identify the real location of this bone known as the sphenoid bone. For us, we have the inferior view of the skull, and the sphenoid bone dominates this location. We as well have other bones of the skull, and for the few we've been able to discuss about them, but for the others we'll be able to get them as we move ahead. So this is the bone itself, which is the sphenoid bone, and this is the anterior view. We at least have those structures, including the body of the sphenoid. We have the greater wing and the lesser wing, which is right there, and as well the pterygoid process of the plate. And we at least have other structures, including superior orbital fissure, which is right there. We as well have the sphenoidal sinus within the body of the foramen rotundum and the optic foramen or the canal. This is the same bone as this. And let's get ahead to find another structure of the skull. This is from below, and we have our sphenoid bone right there. This is the sphenoidal and the occipital bone, and as well few the cervical vertebra. As you can see, the atlas and the axis, the first two. And for the concern of the sphenoid bone, we have structures that are within its surface. The part labeled 5 is the anterior clinoid process, and we have the part labeled 8, the dorsum sella. We have the part labeled 25 is the temporal surface of greater wing. Then we have 26, which is the infratemporal crest. 16 is the lateral pterygoid plate of the pterygoid process. And then we have 22, which is the medial pterygoid plate. And the part labeled 11 is the hypophyseal fossa or the sella turcica. So those are the structures within the sphenoidal bone from the lateral view. And as we get along or ahead, we'll find a much detailed skeleton of the sphenoid bone. For this is the same as the previous or the former one, which is this. And let's get to learn other structures that are located from this bone. So for the part labeled 1 is the greater wing, then 2 is the lesser wing. Then we have 3, which is the cerebral or superior surface of greater wing, and the part labeled 4, which is pointed right there, which is the foramen rotundum, and the 5 is the anterior clinoid process. 6 is the, let me just move it my direction, is the foramen ovale. Then we have 7, which is the foramen spinosum. 8 is the dorsum sella. Then we have 9, 2 points here and here, and that is the optic canal. Then we have the part labeled 10 is the chiasmatic groove or sulcus chiasmatis. Then we have 14 is the posterior clinoid process. We have the part labeled 12 is the lingular. And we have, what else? I think that's much of what we can see from this bone. This is the sphenoid bone, this is the occipital, and that's all about them. So let's move to the description part, whereby we have the body as the first point of description. The body of sphenoid is the hollowed cube-like medial portion between the ethmoid and occipital bone. It lies on and immediately adjacent to the midline. Its anterior surface forms the superior posterior wall of the nasal cavity and articulates with the cribriform and perpendicular plates of the ethmoid bone. Posteriorly, the body articulates with the occipital cross at the spheno-occipital suture or the basilar, then inferiorly it articulates with vomer. So that's all about the body. and let's get to see other structures. So for the body, as said, is located right there, and as well we have a much detailed structure of the sphenoid bone. So this is the posterior view of the sphenoid bone. Let's get to check other structures. And remember, we did find the optic canal from the other image. We have the lesser wing clearly seen right here, and we have other structures as cleavers. We have the dorsum sella, and never mind, we find its description elsewhere. We have foramen rotundum, which is clearly seen. We have the pterygoid fossa, pterygoid plate, pterygoid humulus, and medial pterygoid plate is that. So this is the lateral, and then this is the medial. So for the optic canals are seen on either sides of the body. They pass anterior-inferior to the lesser wings, just medial and superior to the superior orbital fissure. In the optic nerve, which is cranial nerve 2 and ophthalmic artery, pass through these canals on their way to the eyeball. The sella tuchica is a saddle-shaped depression on the endocranial surface of sphenoid, located posteriorly and inferiorly to the optic canal atop the body of the sphenoid bone. Then for the hypophyseal fossa, which we've been able to see, is the depression of the sella where the pituitary glands is located. Then the dorsum sella is the square plate of bone that forms the posterior wall of the sella tuchica. So we have the hypophyseal fossa, which we've been able to discuss. We have the anterior clinoid process right there, posterior clinoid process. And remember, this is the sphenoid or the sphenoidal bone from the superior view. The dorsum sella, we have it by the part labeled 8 right here. The optic canals of which we've been able to see, it's located right there, whereby we've been told that the cranial nerve number 2 passes through. And as we'll be moving ahead, we'll find other structures. So remember, we've been checking on the rest of the structures, including the greater wing, lesser wings, and all those. But as we'll be moving ahead, remember, we'll find a point named as we've been talking about the optic canal. So remember, as we move ahead, we'll find the part including label 20, which is the sphenoidal crest. Remember, this is the anterior aspect, and then we'll be able to see as well the sphenoidal rostrum. So posterior clinoid process are two variable tubercles located at the superolateral corners of the dorsum sella. Then the cleavus is a slight endocranial hollow that slopes posteriorly from the dorsum sella towards the spheno-occipital suture. Sphenoidal rostrum, of which I've been able to show you, is a midline bony projection on the anterior-inferior surface of the sphenoid, and it fits into the fissure between the ala and the vomer. Sphenoidal crest, it is continuous with the rostrum extending superiorly from it on the anterior surface of the body of the sphenoid, and it articulates with the perpendicular plate of ethmoid and forms part of the septum of the nose. So the sphenoidal rostrum, right there. Infratemporal crest, we shall check. The foramen ovale is right there. Then we have the foramen spinosum. Remember, this is the sphenoid bone from inferior view. So superior orbital fissure, the greater wing is right there. Then orbital surface, sphenoidal sinus, which is the greatest. Then we have the sphenoidal crest, then pterygoid canal, and the pterygoid process, which let's check. For the greater wing, right and left, they are the segments that extend farthest laterally from the body, forming floor of the middle cranial fossa endocranially and much of the temporal fossa ectocranially. Part of the lateral wall of the skull and posterolateral wall of the orbit are included in this greater wing. So the greater wings articulates with the temporals, parietals, zygomatic, and maxillary. Foramen rotundum is located in the most anterior and medial part of the middle cranial fossa at the junction of the greater wings and the body. The maxillary branch of trigeminal nerve passes through this foramen rotundum. Sphenoidal sinuses are large paired hollows within the body of the sphenoid. Foramen ovale Remember, we've been seeing this time to time. So it's located posterior to the foramen rotundum on each side. This is the opening for the mandibular branch of trigeminal nerve. Foramen spinosum is located on each greater wing just posterolateral to the foramen ovale, and they transmit the middle meningeal vessels and the branches from the mandibular nerves. Infertemporal crest marks the ectocranial surface of the greater wings, and they form base of temporal foci at about level of zygomatic arches. Then we have superior orbital fissures, and these are the opening spaces between the inferior surface of the lesser wings and the anterior surface of the greater wing. So we have the lesser wings is definitely seen, and without even referring from the numbers, this is the lesser wing, and the greater wing is labeled right here. So for the part labeled one is the greater wing, yeah, that's obvious. And then we have the lesser wings as said. Then we have as well this part of the sphenoid bone, which is the cerebral or superior surface of the greater wing. And we have the part labeled 4, which we've been able to describe is the foramen rotundum. Then we have another part, which is 5, and that is the anterior clinoid process. 6, this point is the foramen ovale. Then we have another part, which is let me just move using the numbers. We have the part labeled 8 is the dorsum sella. And then we have the part labeled 9 above there, which is clearly seen, or else it's also here. So the 2 points is the optic canal. Then we have another part labeled by 13, this area, that is the opening of sphenoidal sinus. Then we can move to the part labeled 15, that is the pterygoid canal. Then we have 16, which is the lateral pterygoid plate of the pterygoid process, which we shall be checking on that. Then we have the part labeled 17 is the pterygoid notch. 18 is the pterygoid humulus, and then 19, of which we've been able to describe is the orbital surface of greater wing. Then 20 is the sphenoidal crest. 21 is the sphenoidal rostrum. So we've been able to identify from the other image. Then 22 is the medial pterygoid plate as said. Then we have another part labeled by 23, which is the superior orbital fissure. And finally, the part labeled 24 right here, that is the spine of sphenoid bone. This is the anterior aspect, this is the posterior aspect. So other specific structures can be seen or can be identified from the anterior, while others will be identified from the posterior. Orbital surface is the orbital surface in the greater wings, which forms the lateral wall of each orbit. So that is what. Let's just get back to the image so that we can identify. So the part orbital surface is right here and forms part of the orbital wall. So the lesser wings, they are thin wing-shaped posterior projection of the ectocranial surface, and they rise from the superior surface of the body and articulate with the horizontal orbital plates of the frontal. They partially floor the right and the left frontal lobes of the brain. Anterior clinoid process are the posterior projections of the lesser wings, and they give rise to the tentorium cerebelli, a segment of dura mater that separates the cerebellum from the occipital part of the cerebral hemisphere of the brain. Pterygoid process are only visible from below or to the side of the cranium. So I think this is the same image from the one we've been checking on, and this is the superior view of the sphenoid bone, anterior clinoid process. That's all that you can see, epiphyseal fossa, then the posterior clinoid process. Lateral pterygoid plate is a thin vertical plate of bone seen in the lateral view of the cranium. Then we have medial pterygoid plate is a thin vertical plate of bone that roughly parallels the lateral plate in orientation, but closer to the midline. Each plate articulates with the palatine anteriorly. The four pterygoid process are the attachment point for medial pterygoid muscle, which is mandibular elevators. Then we have pterygoid fossa, are rough hollows between the medial and the lateral pterygoid plates. So this is the same image, just to refer for the parts which we'll be able to, or we've been able to see. So we have the part labeled 15 is the pterygoid canal. Then we as well have the part labeled 16 is the lateral pterygoid plate of pterygoid process. Then we have the part labeled 18 is the pterygoid humulus. And finally 22 is the medial pterygoid plate. We have the pterygoid canals. They perforate the bone above the pterygoid and run along the base of these plates. And then we have the pterygoid humulus. You can go back and check on that. The pterygoid humulus, of which is the hook-like process forming the posterolateral dorsal corner of which medial pterygoid.